you. I am Helen Worthman from the Marketing and Communications team at BU School of Social Work. Thank you for joining us in the room and online for a very special evening as we celebrate the collective research of our School of Social Work faculty on the timely topic of economic insecurity. For our Zoom audience, please let us know if you can hear and see us by writing in the Q&A box. Before we begin today's presentation, I'd like to review a few event details. Our moderator, Professor Hahm, will outline the format and briefly introduce our 6 presenters, who will each share their research in a lightning talk format. Once the presentations are complete, they will join Professor Hahm at the table and take questions from our audiences, both in person and on Zoom. For those on Zoom, please type your questions into the Q&A box. We will share those with the presenters and take as many as time allows. Tonight's event is also being recorded and will be available on our website. And now I'd like to introduce the Dean of BU School of Social Work, Barbara Jones.
Well, hello everyone, and thank you so much for being here tonight. I'm personally thrilled to be able to celebrate and share this vitally important work from our faculty colleagues today. Now more than ever, it is critically important that we amplify and support social work research. Today's presentations highlight work focused on improving and changing policy to better support people as they face economic insecurity throughout their lifespan. I'm grateful to Professor Hyeouk Hahm as our Associate Dean of Research for gathering our colleagues today to share these findings so we can continue to positively impact the lives of those who need our support. So now, will you join me in welcoming our moderator, Professor Hahm?
Thank you, Barbara. And thank you, everybody. Today's a really freezing day, but you're all here, so we're so excited. So a few months ago, I had a conversation with one of my master's students at BU School of Social Work. I will call her Amy. She's a 27 years old white woman who is incredibly bright and has full of potential. Everything seems to be going well for her. She was newly engaged and she was recently accepted into the top social work PhD program in the country. One day, she and I were talking about the inflation and economy. And she said to me, Professor Hahm, in my generation, we know we cannot have it all. We can either buy a house or have a child. We cannot have both. I was so struck by what she said. And Amy has every reason to feel that way. Consider these facts. 1, in 2024, the Urban Institute found that 52% of Americans are financially insecure. That means they can cover basic expenses, but they cannot save for the future. Number 2, in 2023, 18 million US households experience food insecurity. That means they're not certain if they could afford their next meal. In 2025, the median price of single-family homes in greater Boston area was about $470,000. But in 9 years, by 2024, it has risen to $750,000, which is a 60% increase. And you and I, we all know the gap between the wealthy and everyone else is widening. Today, the top 1% of US household earns 139 times more than the bottom 20%. Therefore, the reality of Amy is not just a personal dilemma. It is a painful reality that American dreams are increasingly out of reach for many. As you know, this economic insecurity and anxiety played a fundamental and critical role in 2024 US election results. Yet, despite all these challenges, solutions remain complex. However, research has power to change. And this is exactly why, and this is exactly what we are here to explore tonight. So this evening, as part of our first Research in Action event, I am so honored to introduce our 6 wonderful faculty experts who will lead us in a discussion on how economic insecurity is shaping the lives of Americans today. So first, Professor Dolores Acevedo-Garcia is a renowned researcher of child health equity and social policy and a director of a newly created Institute for Equity in Child Opportunity and Healthy Development, who recently joined our school. Second, Associate Professor Yoonsook. She focuses on uncovering gaps in anti-poverty and social policies that impact on low-income families to enhance economic and social justice. Associate Professor Tom Byrne's research focuses on the causes, consequences, and policy solutions to homelessness and housing insecurity. Professor Mary Collins is an expert on child welfare, and her work focuses on developing supportive policies and programs for older youth state systems. Assistant Professor Peter Treitler's research aims to improve well-being for people with a substance use disorder and inform more effective solutions to the nation's critical substance use and challenges. Finally, not the least, Professor Judith Gonyea's work centers on older population and these populations, the goal of advancing equity by using the intersectionality lenses to explore how an individual's multiple identities, such as gender and age, intertwined to shape their aging experience. So each one is going to give us 7 minutes talk. Now, I invite Professor Acevedo-Garcia to the podium.
Hi, everyone. I'm delighted to be able to present today. So the meeting is about economic vulnerability across the life course, and we're going to start with childhood, and particularly with a group of children that face a lot of adversity on different fronts, including economic vulnerability, and that is children in immigrant families. One in 4 children in the US today are growing up in immigrant families. We define immigrant families as families in which at least one of the parents is an immigrant or a foreign-born person. I think that listening at the anti-immigrant rhetoric today, you would never guess that this group of children is so central to who we are as a nation. It would be hard to kind of picture that, right? Because we talk about this group as if it were a very distinct, marginalized group, but it's actually a huge proportion of our child population. That's something important to keep in mind. We had a wonderful webinar last week, the Center for Innovation in Social Work and Health. They had a discussion about something that we are all very aware of now because of the, again, the very loud anti-immigrant rhetoric, which is the immigration enforcement threats that our children are facing, right? Threats of separation from their parents, deportation, all kinds of things that make children obviously very anxious and require that our profession of social work and other professions try to protect these children during this time in particular. And this is also overwhelming a lot of the systems that we have in place, including healthcare, schools, etc., that need to know how to react, in case of an event like deportation, right? So something that is another risk that the children are facing is economic vulnerability. And today in the US, more than 4 in 10 children living in poverty are children in immigrant families. That is 4 million children, right? So we have to look at the policies that we have to protect children in poverty and think about what are we doing about this particular group of children. So before we go into a specific example, I want to show you this picture, which I don't expect anyone to read or try to comprehend. It's actually busy and overwhelming. No, obviously, it's more for a journal article. The reason I wanted to show it today is because it presents a lot of the risks that are specific or higher for children in immigrant families. And there are a lot of those risks, including, as we already said, immigration enforcement, also their parents being in occupations that are high risk, high occupational risk, low wage, etc. So that is one set of risks that encompasses a lot of different areas of life, and these children are growing up in that environment. The part of the graph that I want you to pay attention to is what researchers call the continuum of legality. So if you listen to the anti-immigrant rhetoric today, we are given this false dichotomy of illegal versus legal immigrants or undocumented versus other immigrants. That is just not true. Immigrant families, all families, in particular immigrant families, are complex. So it's not rare to find immigrant families in which you have US citizens, legal immigrants, undocumented immigrants, and the same is true for communities. So when we have social policies and immigration enforcement policies that are trying to be punitive against undocumented immigrants or undocumented children, that is just not true. They're also being punitive of legal immigrants and citizens. And that just by definition, because no one lives in a family, almost no one, that is exclusively one immigration status. That's rare. So this is what we are facing today, right? A lot of dangers in terms of immigration enforcement. And also a lot of issues with economic vulnerability. So I want to talk about an example of this. And please don't look at this yet. So this picture is showing you some research that we have done about the earned income tax credit. In the US, our social policies to protect children in poverty are, for the most part, all of them in different ways, restricted for children in immigrant families. But I want to talk about the earned income tax credit because it's one of our most important anti-poverty policies. And it's also a policy that has probably one of the most restrictive types of eligibility. And excluding children in immigrant families from this very important policy is hurting them. So what is the earned income tax credit? You can think about the earned income tax credit essentially as a supplemental income. If you are a working family, so remember the word earnings, it's earned income tax credit. So if you are a working family and you pay taxes and you are relatively low income, you can get this really important boost by receiving this tax credit, which is refundable. So that means you actually get extra income. So you think about a family that is earning, say, about $30,000, family of 2 parents and 2 children. And this tax credit, if they earn about $30,000, would be the maximum that it can be at about $6,000 per year. So there's obviously a huge boost for your income. Now I want you to think about 2 families. They are very, very similar. They are both working. They are both paying taxes. And one of them is they have 2 parents don't have social security numbers, which is the proxy in this policy that we use for not being a documented immigrant or legal immigrant. And both of them, both of the children are US citizens, right? So this family, even if just one member, one parent, or one of the kids did not have a social security number, they would forego the EITC completely. So this boost of $6,000, they wouldn't get at all. If you had the same family, but all of them had social security numbers, of all of them were US citizens, they would receive the $6,000 in additional income. So what we did is we did some simulation work with colleagues from the TRIM3 modeling, simulation modeling team at the Urban Institute. because we wanted to see what happens if we restore eligibility for the EITC for families that do not have Social Security numbers. And the result is here. One thing that happens is that the overall child poverty rate decreases by 6%, but for children, citizen children in families with undocumented members, the poverty rate decreases by 30%. These children start with one of the highest poverty rates that we can find, 30%, compared to about 10% for US children overall. So it's a very, very high poverty rate. So obviously we could do a lot by restoring eligibility for the EITC. So just very quickly, because I was told a while ago that I only have 1 minute. What are we doing right now? So I actually think about the word action. Literally, I was reading emails from colleagues that are kind of trying to calculate the effect of actually restricting eligibility for another tax credit, the child tax credit, that has more generous eligibility than the EITC, because that's what the government is thinking about now. So in our presentation of these findings, we've been saying what we need to do is make the EITC more inclusive of immigrant families. So what they are thinking about, the administration is thinking about, is we're going to make the CTC, the child tax credit, less inclusive. We are going to model this child tax credit after their income tax credit. So people are scrambling right now, literally before coming here. I read these emails to try to produce estimates of how many children are going to be hurt by that and what's the poverty increase that we're going to be seeing because of that. So we are trying to get organized to create a hub on children and immigrant families to work with advocates. We have a really good experience working with Unidos US and with colleagues from the School of Social Work at Columbia University, the Center on Poverty and Social Policy, to try to create these estimates in a way that makes them usable, because they will be produced routinely and be given to people that can do something with them to advocate for these families. So that's my presentation, and I'm going to go to the stage my colleague Yoonsook.
So imagine a mother, let's call her Alex, raising 2 children, young children, while working low-wage jobs. Alex wants to provide a better life for their kids, but every month she faces a tough choice. Should she pay for childcare or rent? Without affordable childcare, they risk losing their job. But with their childcare subsidies, they can work, build financial stability, and give their children the opportunity to thrive in a nurturing environment. Alex is not unique. Across the US, childcare subsidies are a lifeline for many low-income families, helping them stay employed and ensuring children have access to high-quality early learning. But they are more than just financial assistance. Childcare subsidies are 2-generation anti-poverty strategy. They are an investment in families. They help parents achieve economic stability while supporting children's development, really breaking the cycle of poverty for the next generation. So my research focuses on childcare subsidies as a 2-generation anti-poverty strategy. So research shows that parents receiving childcare subsidies are more likely to be employed, stay employed, and then see income growth. So one of my early studies, actually from my dissertation, a long time ago, found that, as you can see in the graph, long-term stable subsidy used to lead to significant sustained increase in parents' earnings. Childcare subsidies benefit children too. Compared to children in similar environment that doesn't receive childcare subsidies, children using childcare subsidies are more likely to enter kindergarten, ready to learn and succeed in schools. But here is the problem. Childcare subsidies only work if there are enough high-quality providers who are willing to serve these families. Oh, sorry. So childcare has been underfunded for decades, but COVID-19 exposed just how fragile the system really was. 70% of childcare programs closed during COVID-19, and we haven't fully recovered since then. and 40,000 fewer childcare providers are in the field today compared to pre-pandemic levels. So more parents than ever, which is 17% more compared to pre-COVID, are missing work, reducing hours, and leaving their job because they can't find childcare that works for them. And the impact is clear. So we begin seeing a decline in kindergarten readiness scores. So in response to that, federal and state governments stepped in to stabilize childcare market, focusing on supporting providers. So our Massachusetts Childcare Research Partnership has been at the forefront of this work, examining the impact of government investment. So we use variety of data, including state administrative data, provider survey, and interviews with providers, families, and other stakeholders. And I also want to acknowledge, I don't know whether they're probably there in the Zoom, Dr. Pam Joshi, Dr. Kay Giapponi-Schneider, and here Dr. Julie Nicholson here, who have been critical to this effort as part of the team. So here's what we found. Providers are resilient and deeply committed to serving low-income families. So let me just emphasize, these are providers who serve kids from very low income and children involved with the child welfare system and children of families experiencing homelessness. So one provider shared, serving these families who are in the greatest needs is a privilege. They are working toward a better future, and if you give them a little bit of help, they can go so far. But 23% report moderate to high burnout. They are stretched too thin by administrative challenges related to managing subsidies and then also their businesses and behavioral challenges from children and limited engagement from parents. And then they express it, they need more financial support. Even with the recent increases in state funding, providers say, we are going to the right direction, but subsidy still doesn't cover the real cost of childcare. And then providers also emphasize the need for more resource, support, and better training. So I just want to be clear, they are skilled professionals, but they need more in-depth and hands-on training that truly prepare them for the challenges. So one provider put it perfectly. We really need something with some meat on it that we can sink our teeth into and really use in the classroom. So these voices makes it clear. Childcare providers are the backbone of the childcare system, but they are struggling to sustain their essential work. So the good news, we live in Massachusetts. So Massachusetts is one of the few states that has not only maintained, but expanded its pandemic-era investment in childcare. So we are seeing funding for higher payment to providers, capital investment in childcare facilities, and universal pre-K for 4 years old in gateway cities. But we have to go further. So our ongoing research is working to answer key questions. So how do state subsidy investment impact provider participation and families' access to high quality care? And what policy solutions can expand access to supportive services and enhance provider support? So because here's the bottom line, childcare is not a private issue, it's a public good. A strong childcare system fuels economic mobility, reduces poverty, and ensures all children have a strong foundation for the future. So when we invest in childcare, we invest in families, we invest in children, and we invest in our communities. So it's time to make this investment count. Thank you. So now I'd like to invite Professor Tom Byrne.
Thank you. Good evening, everybody. Today, I'd like to share with you some findings from a study that examines the impact of housing assistance programs on the health of children. As many of you are likely aware, we are facing a growing nationwide crisis of housing affordability here in the United States. This slide shows just two indicators of this problem. The graph on the left shows that substantial increases in median rent over the past 20 years have far outstripped the corresponding changes in median household income. The graph on the right shows increases in the number of cost-burdened renters That is, households paying more than 30% of their income toward rent, which is the widely accepted metric of housing affordability. The most recent data show that in 2022, nearly 23 million renter households were cost burdened, which is a roughly 60% increase over the preceding 20 years. This means that roughly half of all renter households in the United States are now in housing that would be considered unaffordable. In the context of this growing affordability crisis, there's increasing interest in expanding housing assistance programs that help low-income households afford housing. As it stands, currently, only 1 in 4 households who meet income eligibility criteria for federal low-income housing assistance programs actually benefit from these programs. And an expansion of housing assistance carries with it not just the potential to improve housing outcomes, but to drive improvements in health. This slide summarizes the widely accepted theoretical model by which housing assistance is hypothesized to affect health. Housing assistance is likely to drive improvements in health through 4 pathways. First is cost. By reducing housing costs, housing assistance should free up resources that households can spend on needed healthcare and other goods and services that are conducive to good health. Second is consistency or stability. Housing assistance reduces the risk of homelessness and housing insecurity, and thus can avoid well-documented negative health consequences of housing instability. Third is conditions or quality. Housing assistance can help households obtain better quality housing, thus reducing ill effects of housing that has poor quality, like lead paint or mold. Finally is context or neighborhood conditions. Housing assistance should help households to be better able to afford housing in neighborhoods with characteristics that are more conducive to good health. Today, I'm going to share with you some preliminary results from a study that is focused on one factor that might modify the impact of housing assistance on health, primarily via this cost pathway. Specifically, the study whose results I want to share seeks to understand whether the effect of housing assistance on health outcomes is stronger in communities that have more serious housing affordability challenges. Our hypothesis is that in areas with worse housing affordability problems, housing assistance should represent a relatively more valuable benefit than in areas with less severe affordability challenges, because absent housing assistance, households would have to dedicate proportionally more of their income towards rent in more expensive areas. In turn, we expect that housing assistance is likely to generate a stronger income effect in less affordable areas, and children in households receiving housing assistance in these areas will derive larger health benefits from such assistance. To test this hypothesis, we used a unique data set from the National Center for Healthcare Statistics that links retrospective administrative data from the Department of Housing and Urban Development with data from the National Health Interview Survey. These data allow us to capture the health status of individuals who are current and future recipients of federal housing assistance. To examine the effect of housing assistance on health outcomes, we borrow a design used in previous research and compare the health status of children who are receiving housing assistance with those who are not currently receiving housing assistance, but who we know will enter federal housing assistance within 2 years, and whom we therefore consider a pseudo-waitlist comparison group. We then stratify children into 3 groups based on the severity of the housing affordability challenges in their respective communities, which we term as communities with low, medium, and high affordability challenges. And this slide shows the preliminary results of our analysis. The most left-hand column shows what we found with respect to the overall relationship between housing assistance and health. Overall, receipt of housing assistance is associated with reduced risk that children or members of their family will delay needed healthcare due to cost, of needing but not being able to afford medical care, and food insecurity. The 3 right-hand columns show what we found when we looked at the relationship between housing assistance and health separately in communities with low, moderate, and high affordability problems. And the pattern we found is that we consistently see an association between receipt of housing assistance and reduced risk of the outcomes we considered in communities with moderate or high affordability problems, but we don't see a similar association in communities with less severe affordability problems. This finding suggests that the overall effect of housing assistance is driven by the effects that we observe in communities with more serious housing affordability problems. The likely explanation for this finding is that housing assistance frees up relatively more resources for households in expensive communities, meaning that there's a more powerful effect for them in terms of being able to access needed healthcare and reduce their risk of food insecurity. The key implication for policy would be that in the context of ongoing conversations about expanding the availability of housing assistance, targeting the expansions of housing assistance programs to communities with more severe housing affordability problems could generate greater improvements in cost-related health outcomes, in addition to the very real benefits that households would derive in terms of housing stability and affordability. Thank you very much, and I would and I'd like to introduce my colleague, Professor Mary Collins.
Thank you, Tom. Very good to be here with you tonight. And my focus is on a population that's a little bit older than the first three presentations. So I have long focused on adolescents and young adults, and this presentation is particularly on the young adult population. I think they're central to our society and get neglected in a lot of policy discussions. And it's really a time of life when, with the right supports, even if you've had some challenges earlier in your life, you can make a nice trajectory to a healthy, happy, productive, well-being lifestyle. So it's an area that I've been committed to all of my career. And so happy to share with you a few of my research findings and a few of my thoughts tonight. The problem and the policy. So we call the problem often disconnected youth. Sometimes the term opportunity youth is used. That really reflects that if we invest, we are providing opportunities to young people. In other countries, particularly in Europe, the term NEET is used, N-E-E-T, not in education, employment, and training. That term has never been, is not really used in the US. More commonly, it's disconnected youth, so I'm going to stick with that. Recent research, the most recent research is about 11% of individuals 18 to 24 in the US are not enrolled in school or in education. There's a lot of research about the negative effects of this. I obviously don't have time tonight to talk with you about that, but not being connected to school and work for long periods of time during this age period is related to a lot of negative effects. So it's a problem worthy of our attention. The other thing is there's heightened risk for some young people versus other young people. And so there are race issues involved, locality, gender issues involved. And we got involved in studying this because of our interest in youth involved in the child welfare system or the juvenile justice system. So there too, young people who have had experience in that system are much more likely to be disconnected. The policy that we've been looking at for the last several years is a federal policy, the Workforce Innovation and Opportunity Act, which we call WIOA, and has a specific youth program. The legislation also serves other disadvantaged persons like veterans, for example, but we've focused on the youth program. And a federal program that will provide resources to states and localities to develop the services to help young people be engaged in workforce, either education and or employment. And a lot of our focus has been on the policy implementation aspects of the legislation. What happens at the local level? WIOA, being a federal policy, covers the entire United States. So no matter where you live, you are covered by WIOA. But how it's implemented depends a lot about this, about what has happened at the state level and at the local level, including the resources that are available, employers that are committed, the education and training programs available, et cetera. So what happens at the local level to implement this policy is critical. And the other introductory comment I'll make is the term career pathways is used a lot in WIOA. It's used elsewhere too. The notion that it is more beneficial to help somebody in need of connection to be engaged in a career pathway, a sequence of steps to help you get to a career and employment option that's going to work for you. And I say that because that is conceptually, that's a much better idea than simply putting somebody in a job, regardless of what that job is and what somebody needs. So career pathways is central to this policy arena. I'm going to briefly describe 3 studies that we've worked on in this area. Primarily, the first box is focusing on the WIOA implementation. And there were actually 2 studies, but they asked similar questions, so we often treat them similarly. I'll give some recognition to doctoral student Adriana Spindle-Jackson, who worked with me on a lot of this project and who will soon be graduating. But focusing on the implementation, we did a lot of qualitative interviews at the local level and with the state workforce development programs to ask, how do you implement WIOA? In totality, we had 62 interviews in 29 localities throughout the United States. So we got a real feel for how things work differently in different areas. That was exciting to us. The topics of the interview are much the same across interviews. I've listed them there. We were looking at innovation. We were looking at how they worked with the state workforce board, the local contractor, the resources in their agency. It happened that the study, I remember this, unfolded just as COVID started. So I was very nervous. Nobody will want to talk with me because they're so busy working on COVID-related issues. But that wasn't the case, and it actually ended up being quite interesting because they talked about how COVID impacted what they did. Anyway, I'll share some findings about that with you shortly. The other recent study that we've been working on, this is with my colleague Ashley Palmer, who's at a different university, is we have some funding to do analysis of PACE data. PACE stands for Pathways to Advancing Career and Education. Again, it's a career pathways initiative at, I believe, about 15 different programs at different parts in the United States, and it's a randomized clinical trial. So they have both people who received the career pathways training and people who did not in a control group, and collected longitudinal data over 3 years. So we're tracking that over 3 years to see the impact of their engagement in the Career Pathways program. I share on this slide some of the results from the policy implementation study, the series of interviews that we did. Being a qualitative interview, we had a lot of data, so we actually had a lot of findings, hard to capture in one slide. So I've put on this slide 4 of our key results and some of the implications of that. So I'll highlight just 1 or 2. The first one is that we found workforce development being highly variable in how they engaged with child welfare and juvenile justice systems. And that was the reason we started down this path, is because those populations in child welfare and juvenile justice are eligible for WIOA services. So we wanted to know at the local level, how is the WIOA system working with these other 2 systems? And we found not very well. A little bit more so juvenile justice than child welfare, because juvenile justice tends to be older, and we think that's the key reason. But the happy part of this is they were very interested in working with these systems. And so I think there's a lot of opportunity to engage with the systems. They saw it as their role to engage with child welfare and juvenile justice populations. The second finding also is something that they weren't doing very well, but they had a lot of interest in. And that was questions about how do you engage youth voice in what you're doing, in your policy development, in your service delivery. And many of them were like, well, I'm not sure we ever thought about that very much. A few of them, like, we tried that. Some of them were a little bit more engaged in that idea. But a lot of them were like, wow, that's a really good idea. We should start doing that. Some of the people we interviewed were social workers or in social work roles, not a lot of them. And kind of anecdotally, when we did talk with social workers, they were much stronger on the ideas of youth voice and getting youth involved in these sort of things. So my concluding comment, which I'll get to shortly, is there needs to be more social work engagement in this policy area, and we'll help do that. All right, I'll move on. My time is short. This final slide is from the more recent study. As I said, we are using this PACE data that is 3 years in duration and with a randomized control group, randomized and random control group, and we're doing some data analysis. This slide is a latent class analysis that has identified different patterns that young people, the group of young people have as they go through the 3 years. And the next step of this analysis is to understand what are the characteristics that have the more positive trajectories versus the less positive trajectories. Let me leave you with a few takeaways from this range of work on WIOA and the workforce system. I think I'll emphasize what a critical time point this is. Young people, young adults, they're often looking for the next step. They're often open to opportunities. The WIOA system, like many of our systems, is woefully underfunded. So that's always policy recommendation number one. We saw a lot of interest, heard a lot of things about creative, innovative, community-based initiatives going on in some places. And in other places, it seemed pretty lackluster and there were not a lot going on. So that speaks to how there's great diversity and how this is unfolding at the local level, and finding ways to take the innovative, exciting, helpful strategies and making them more up to scale so that they can get to other places would be good. And then, like I said, my final takeaway is there's really a lot of room for social work involvement in this field. And I think with more social work involvement, we'd hear more things like the importance of youth voice. We'd hear more about the need for wraparound services for young people who are struggling in this area. We'd hear more about some of the innovations and helping young people who get off track. There's a lot of talk about the pathway, the on-ramp. What happens when you get off the ramp? How do we get people back on the ramp? So kind of, I think social workers would be particularly good, making sure that once people drop off, we can get them back on. And of course, social work involvement and policy development will help all of those principles of workforce development be more robust in this field. So thank you. And I will introduce my colleague, Professor Peter Treitler.
All right, good evening, everyone. I'm Peter Treitler. Today, I'm going to be talking about Medicaid's role in expanding access to opioid use disorder treatment for low-income Americans. And Medicaid, of course, is a very important program across the lifespan, particularly for children who, I think around 40 or 50% of children are covered by Medicaid in most childbirths. But because I focus on opioid use disorder, I'm going to move a little further along the lifespan. And this particular disorder mostly impacts the adult population. And I tend to focus on the 18 to 64 age group because people over 64 are covered by Medicare, which becomes the primary payer. So just start with a little overview. I think everyone in this room has probably heard a lot about the opioid crisis by now. It's been in the news for 10 or 15 years. But there's been about 100,000 deaths per year in the last few years. That's starting to go down in 2024 for the first time in a long time. And most of those overdose deaths involve opioids. About 6 million people in the US have an opioid use disorder, so this is a very highly prevalent issue. And then as far as Medicaid, it's one of two very large public insurance programs in the US, with the other being Medicare. But Medicaid alone covers about a quarter of the US population, so 73 million people, so an enormous program. Medicaid expanded in 2010, so that's been very important for the population with opioid use disorder, because before the expansion, people were usually only eligible for Medicaid if they were parents of children, and those children were also eligible for Medicaid, as well as disabled people and elderly people that met the income requirements. But with expansion, childless adults could also be eligible for Medicaid, and childless adults is a lot of the population with opioid use disorder, so people who previously didn't have any insurance coverage at all newly gained eligibility for Medicaid. And because of that, Medicaid is the largest payer of opioid use disorder treatment services, and it pays for about half of all of those services. Outside of the specialty treatment system, it also pays for a huge amount of the emergency care for people with opioid use disorder. So think about things like overdose or infections or accidents related to drug use. When people show up at the emergency department, a lot of that care now is paid for Medicaid, paid by Medicaid. And as I mentioned a minute ago, the expansion, people with opioid use disorder are disproportionately part of this expansion population. So Medicaid expansion has been really important for access to care for people with opioid use disorder. And so with that background, like, why is Medicaid so important? Why is insurance so important? And there's a few reasons. One, it improves access to treatment. So one of the major barriers to treatment is payment. Before Medicaid expansion, many people just simply couldn't go to treatment because they couldn't afford it, or they had to use some patchwork of funding sources. But with Medicaid, treatment is much more broadly available to low-income people. Medicaid also covers a lot of support services, of course, other care for other health conditions, which intersect with opioid use disorder. And so ensuring that people get access to that type of care ensures they can enter recovery. It reduces financial barriers and improves economic stability. So thinking about kind of the focus of this talk, right? It's very important to have insurance so that you don't have some type of like financial crisis if you get hit with a $200,000 hospital bill for an overdose or endocarditis or something that can completely derail your economic future. And then having Medicaid and being able to get treatment also allows people to move further towards economic security through employment or furthering their education, because of course, if somebody is actively using opioids, they're not really going to have much of a chance of being successful in either education or employment. So turning now to some of my own work in this area, I'm going to talk a little bit about how Medicaid impacts access to buprenorphine. And buprenorphine is one of 3 FDA-approved medications to treat opioid use disorder. It's one of the best available treatments. So it significantly reduces cravings. It reduces the risk of overdose by somewhere around 50 to 80%. And it's widely available. So if you wanted to get a buprenorphine prescription, you could see just about any physician. I mean, many don't prescribe it, but you can get it in any setting where the physician is willing to prescribe it. And so myself and some colleagues from Rutgers, we used nationally representative prescription drug data from IQVIA. And so this is basically claims data from more than 90% of pharmacies in the United States. So you can get like a real census of all the buprenorphine prescriptions in the entire country. And we looked at trends in the percentage of those prescriptions that are covered by Medicaid versus other payers. And what I show here is the percentage that's covered by Medicaid in 2016 and 2022. And so you can see pretty clearly that there, the red is 0 to 20%. And so in 2016, this is shortly after Medicaid expansion, very few prescriptions were covered by Medicaid. And then that looks quite different in 2022, and about half of states are over 40%. Quite a few of them also between 60 and 80%. So Medicaid has over time become much more important to access to buprenorphine and other effective forms of treatment. This plot over here shows the correlation between the percentage of prescriptions paid for by Medicaid versus the percent paid cash, self-pay. Again, I want to remind you that having to self-pay is a major barrier to treatment because many patients will just forego the treatment if they don't have insurance helping them out with the payment. And so basically what we found is, not surprisingly, that the more prescriptions that are paid for by Medicaid, the fewer are paid for self-pay. And then you can also see there's different colors and shapes representing whether states had expanded Medicaid. And so over here, these are the states that hadn't yet expanded Medicaid, and they have a much higher share of self-pay prescriptions. In addition to that, we also found overall that states that where more buprenorphine prescriptions were covered by Medicaid also just had better buprenorphine access overall, regardless of the payer. So even patients who had private insurance or Medicare were more likely to get that form of treatment if they were in a state that had more Medicaid coverage for buprenorphine, because it allows the system to expand in ways that's not possible when that consistent stream of funding source is not available. And so I'll just wrap up with some of my concerns as someone who studies this, and thinking about the current political moment where there's a lot of proposals to cut Medicaid, and there would be a real significant impact on people with opioid use disorder, along with many other populations. But thinking back to how many people with opioid use disorder are part of this expansion population, they would be particularly impacted if there were any efforts to sort of dial back the expansion. And one thing we've been hearing a lot about is the potential for over $800 million in Medicaid cuts in the next 10 years. And so some of the things on the table there are imposing work requirements, ending the 90% federal match for Medicaid expansion costs, which would effectively, and by law in many states, nullify Medicaid expansion. There's also been talk about per capita spending caps and shifting to block grants. But the end result of this would be pretty catastrophic for people with opioid use disorder, making it really difficult for them to engage in treatment, and then all the consequences that follow from that, including economic security. The other major issue is the impact it would have on the health system, because as I mentioned earlier, a lot of the emergency care is paid for by Medicaid for opioid use disorder. And if that funding source is cut off, that would be uncompensated care that hospitals and other providers would have to absorb and pass on to patients with other insurance types. So we don't really know what's going to happen, but it's certainly an alarming time, given how large of a role Medicaid has taken on in opioid use disorder treatment. So I'll end there and pass it on to our final panelist, Judith Gonyea.
Good evening. In my presentation, I'll speak to the question of why old age poverty has a woman's face and why, without policy reforms, the gender gap in economic security in later life will continue to persist for our daughters and our granddaughters. Before I begin my slide presentation, I want to emphasize that answering these questions very much depend on federal data sources as well as federally funded data sets. Therefore, I would say we are at an important point in our history in terms of access to some of these. As you can see from Table 1, based on the census data, we see that women represent more than 6 out of every 10 of the almost 6 million older persons living at or below the federal poverty level in the U.S. If we expand to include older households with incomes below 200% of the poverty level, which we see is still a very modest income, the number of economically vulnerable older adults rises to 17 million, or 1 out of every 3 older persons. And once again, the majority are women. I would also emphasize, as Table 2 shows, that older women of color face an amplified or significantly greater risk for living below the poverty line. As you see, for example, amongst Indigenous older women, 1 in 5 is living in deep poverty. The roots or seeds of economic inequality begin early in life, as you've heard from our other presenters. Census data shows that the poverty rates for girls and boys are relatively close in childhood. It's in young adulthood that the gender poverty gap first emerges and becomes a divide that is never closed. As Figure 1 shows, the darker blue being men and the lighter blue being women, in fact, we actually see a widening of the gender gap in old age. This is largely because women live longer and have fewer resources that they need to stretch over more years. Given time limitations, I'm going to highlight 3 contributors to the gender divide in late life economic security. The first one being the gender wage gap. As Table 3A shows, in 2024, amongst full-time, year-round workers, women earned on average 83 cents for every dollar men earned. If we include part-time and seasonal workers, we find that women earn 75 cents for every $1 made by men. And once again, if you look at Table 3B, we see that the wage gap is even greater for Black women and Latinas. On average, they earn 65 cents and 58 cents, respectively, for every $1 earned by a non-Hispanic white man. What I would highlight is the rate of progress on narrowing this gender gap. It's been minimal since 2000. In fact, based on its current trajectory, it would take women another 45 years to close that gender wage gap. A second contributing factor is occupational segregation. Women have long been clustered into the pink-collared industries, such as teaching, nursing, and social work, jobs that are often in the nonprofit sector and typically offer lower wages and fewer benefits, including retirement benefits. It's important to note that women of color are disproportionately employed in the lowest paying care jobs, such as child care workers, my colleague Yoonsook, and the women who are home care workers. For example, 90% of home care workers for older persons are women of color, many of whom are immigrants. Nationwide, their average hourly wage is $16.15. The third factor is the motherhood or caregiver penalty. Caregiving often leads to career earning losses through interrupted work histories, seeking part-time employing, or working in lower paid jobs to have flexibility. The Urban Institute estimates the economic cost to women who care for children or for adults who need care, on average, results in foregoing $295,000 in lifetime income, not an substantial sum of money. Closing the gender gap in late life economic security requires changes in both our labor policies and our retirement policies. This includes reforms to Social Security. Women have a huge stake in Social Security. Almost half of unmarried women, and this includes widows, rely on Social Security for 90% or more of their income. So today what I'll do in the time I have is raise some examples of policy reforms that are needed. First, developing a Social Security caregiver credit that assigns a dollar value to unpaid family caregiving, which is then included in the 35-year benefit calculations. In doing so, women who exit the paid labor force for 1 or 5 or 10 years have those years no longer averaged in as 0 income years. The second is creating a federal paid family and medical leave program. The U.S. is the only high-income country that does not offer paid leave, and one of only a few countries in the UN that does not offer at least paid leave to parents of newborns. Currently in the U.S., 13 states and D.C. offer paid leave. Third is we need to approve the federal automatic IRA program legislation. It would allow an estimated 55 million U.S. workers not covered by an employer-sponsored plan, who are disproportionately women and persons of color, to participate in a tax-deferred workplace retirement plan. Evidence shows that states that have introduced automatic IRA plans have seen increased savings, including narrowing the savings gap somewhat for women and persons of color. And fourth, I would speak to the need to raise supplemental security income, or SSI, benefits to close that gap between Social Security and poverty. That would lift approximately 5 million more older adults above the poverty line. So with that, I will turn the back to Hyeouk. Oh, sorry, I got the clue. I'm really bad at this. Back to Hyeouk. Thank you so much.
Thank you so much, everybody. So now I'm going to invite all the presenters to join me on stage for question and answer session. Please. Thank you. So we're going to start our in-person audience first. So please raise your hand if you have any question, and our staff will bring you a microphone.
Hello. Okay, cool. First of all, thank you to everybody who presented. That was a wonderful presentation night. I personally learned a lot. But my question is for Dr. Byrne. In your presentation, you talked a lot about housing aid and how that affects people's health, but I was wondering if you could elaborate more on the effects of housing itself on people's health.
Jeez. Yeah, I mean, I think the same pathways that I talked about by which housing assistance can positively impact health, you could think about that as housing problems, whether it be with respect to living in unaffordable housing, poor quality housing, housing that's located in neighborhoods with conditions that are have documented negative health impacts, or if you're experiencing housing insecurity or homelessness. All of those things have real impacts on people's health. And so kind of the mechanism, I think, is exactly the same when we're talking about how housing itself impacts health, and housing assistance can generate housing improvements along each of those pathways by allowing people to, for example, with respect to costs, which is what the work I was presenting, if you offset people's housing costs, they have more resources that they can spend on things that they need that are good for health. Now, if that assistance isn't there and someone is paying 50, 60, 70% of their income towards rent, which is the norm for people with extremely low income, you can think about how that would have a negative impact on health.
Thank you all so much for these really wonderful, thought-provoking, sobering presentations. And so this is an open question, however many of you want to answer it. How do we get this information out there in a much more accessible way, given the moment that we're living in? I mean, each of you, I could ask a question about that, right, very specifically, but I'm really thinking of the impact from all the way through the life cycle, obviously, what we're talking about here. And for many people who don't somehow think that it's going to affect them, it is. And I guess I'm looking for you now to put on how do we use our research, or how do you use your policy research to get the information out there in a digestible, accessible way beyond our sort of academic or people who, think about these sorts of things. So,
Anyone? Would you like to?
I would say, does this work? Okay. I would say a lot of the work I do is in collaboration with other groups nationally and locally. So for instance, there's WISER, Women's Institute for Secure Economic Retirement, that has their goal as giving financial literacy to women. There's the National Pay Equity Committee that I work on. So I think there's the AARP, which reaches out to individuals. And then locally, it's the senior centers. Boston has Elders Strong, which becomes a great clearinghouse for information. So I think it's identifying multiple stakeholders and working to get your message in a way that is compelling and clear to the audiences. But I think wonderful things about BU is the ability to make those partnerships. So that would be one of my suggestions.
So actually, the work that we did showing the effects of improving eligibility for different anti-poverty programs for immigrant families is something that we did because we received an invitation from a foundation, the WT Grant Foundation, during the pandemic to form a partnership with Unidos US. Unidos is the largest national Hispanic advocacy organization, and we didn't have a very large grant, but it's one of the most successful partnerships that I've ever had in my career. It was just wonderful how they really needed the research evidence, they needed the data. We met weekly with them. It was just very intense collaboration, even when the funding ended. And they were in charge of disseminating the results. So they would call meetings of coalitions such as Protecting Immigrant Families. They would organize congressional briefings. They would bring us in front of different people, right? So I think there is often this idea that there is a dichotomy between researchers and people are engaged in advocacy or community-based people, and that's not true. They often want research partners because that's helpful for them. So what we are trying to do now, and we are in the middle of different conversations with funders and possible partners, is to try to create a more regular, what we're calling research to action set of collaborations with yes, people like us or Columbia Center on Poverty and Social Policy providing data and summarizing research evidence, but the counterparts would be all these advocacy organizations. So I think that you need that kind of structure and you need the funding, the research funding to be for that. You cannot do this on the side. The funding needs to be structured for that kind of research to action collaboration.
I just want to add one more thing. I think we scholars and researchers need to use plain language. I think we are so, we have this sense of elitism, and we tend to use a lot of difficult languages, which is people cannot really, we don't necessarily translate them. We assume that people understand that. So I think we should really start learning how to use the plain language and get used to the storytelling. Okay. And part of the reason why the policymakers, Congress, they wanted to really take us down is because they don't understand what we do. They don't understand why we need indirect, which is FNA, which is a facilities and administration. They don't understand why we need it. We never really make time to help people understand why we are doing what we are doing and why is the science is so important. And why is the education is so important? We fail to do that. Sorry for the strong language. But I really think that we have to kind of reflect ourselves. And I think we have to really do more storytelling. And I really want all of us to use social media because it is what it is. It takes time. It takes time. It takes that like for me to write like one thing, it takes 30 minutes. There's a time that we don't have, but we have to make the time. Because we need to engage very, very actively with the public, students, policymakers. This is what we need to do. This is what we must do.
Could I comment?
Yes.
A little bit. Just one thought. It's a little bit less direct to the data, but it goes along with the storytelling and it goes along with the partnership. When I think about workforce development policy and the kinds of things that I talked about, there's a lot of players in that field. And so I talk from a social work perspective, obviously, but businesses are a big player. Who are the employers, as well as state people, trainers, training programs, education universities. So there's a lot of players in that. So it goes to the storytelling and not just my story, or certainly helping to frame it from the youth perspective. But if you can engage with partners appropriately, get the business people on board, get employers on board, that can be very effective rather than going it alone.
Thank you so much. Oh, maybe I think, yeah.
Thank you all. Actually, that was my question, so it's a great lead-in.
Oh.
What would you say is the role of employers or workplaces at the intersection of your particular research?
Yeah.
And I was thinking also about the new commission on housing supply in Massachusetts. I was curious in terms of partnerships with developers, for example, or kind of any other kind of creative ways that you all can think of at the intersection of your research.
So I'll just note again, in our study, which again looked at implementation in many different localities, we found examples of employers being very engaged and willing to put in the training. So we need, as social workers, we need to be careful about the potential exploitation part of this, right? So that's one way that social work needs to be on board with this. But yeah, there were plenty of evidence of, especially large employers who could really invest in a population. And so I forget the rest of your question. So there's examples of that. And I think we need to find ways to build more of that. I mean, the workforce development system also is very data-based in terms of economic projections about growth industries. That's a central part of it. So identifying what the growth industries are in any particular locality, getting key employers on board, helping convince them of the importance of training and putting time into employees, and again, how that benefits them so to not have turnover. Those were some of my thoughts on that.
Okay, I think we can talk about this the entire night right now. And it's really captivating, so interesting. I think we need to take some questions from our Zoom audience with the help with Helen Boardman.
Yes, this question comes from Ellie Zambrano, and it's for Peter. A recent report stated that many Medicare enrollees received medications for their opioid use disorder. Only 40% of Medicare enrollees who started using buprenorphine, I'm sorry if I'm saying that wrong, continued treatment. Can you share your insights on the challenges faced in educating providers to continue medication treatment for Medicare enrollees who started buprenorphine?
Yeah, it's a complex issue. And in a lot of ways, so we've done a really good job in this country of improving access to buprenorphine and getting people initiated on a very effective medication, which 10 years ago, very few people were able to access. But many people discontinue as Ellie, the issue that she raised. So somewhere around, I believe it's about 30 or 40% of people are still receiving that treatment after 6 months, which is very low. It should be, ideally you would want people to be on that medication for as long as they need to, and it's appropriate for them to be on it for years. And there's a number of barriers. Part of it, a big one is stigma, and that's internal stigma that people feel themselves towards medication. There's a belief that it's a replacement of one drug for another. And then a lot of providers also hold that same belief. And so they see it as a short-term solution. Like, you should be on this medication for a month or two until you are, strong enough in your recovery to get off of it. That's a common belief. But then there's also a number of structural barriers that make people discontinue early. There's prior authorizations that a lot of insurance companies require. That's gotten better, but it can still be a difficult administrative process to get the prescriptions. And, if that happens to a patient or a provider a couple of times, that may be enough to keep them away. And then people have all these other psychosocial challenges in their lives. A lot of things that were talked about today: childcare, employment, can I see my provider if I also want to have a full-time job? And people need help in dealing with those types of issues too. They need supports in other areas of their life so that they can stay in treatment.
We have a question from Mary Jo Racone for, I believe, Mary. She says, regarding WIOA, you mentioned 2 government agencies on a local level, DDJJ and Department of Children and Families. How can other systems like non-for-profit agencies that work on a local level engage in these government agencies to aid them using WIOA on a local level?
Thanks. Yeah, there should be, thanks. There are state workforce development boards in every state, And many states have local workforce development boards. Some really small states like Delaware do not have local workforce development boards. And someplace like California has, God knows how many, 90 or so. But a person could find the Workforce Development Board in their locality by searching for it and contacting the Workforce Development Board and asking for opportunities to collaborate, asking for what the services are, who are the members of the local Workforce Development Board, and find some way into it. They should be public meetings, among other things. Some of them post their agendas online and minutes online, but you could always call. So yes, they are in every community, so you could find where they are and engage with them in some way, ask the questions.
And this is for Dolores. Given that there is an increase in persecution of immigrant communities, what health and policy and equity trends do you see happening, and what can we do to address this?
Wow, that's a really hard question. I don't know, it's an incredibly difficult time, obviously. So we have the issue of immigration enforcement, which is urgent, and people are facing that every day. At the same time, I think that we have to keep thinking about the social policy issues that we need to address, because it's part of our long-term picture about what's going to happen with these children and these families. And as I said, when we were working on this topic of the earned income tax credit and the child tax credit and also SNAP, all the proposals that we had were to expand eligibility, because the majority of children in immigrant families are citizens, U.S. citizens, right? So we have to keep that in mind. And just in the last week, we have seen that they're going to try to use the budget reconciliation process to apply to the child tax credit the same rules that we've had for the earned income tax credit. So making another very important anti-poverty program also more restrictive. The Washington Post had some information that Homeland Security is reaching out to the IRS to request information on people that have what we call individual taxpayer identification numbers, which are mostly undocumented immigrants that don't have Social Security numbers, pay taxes using an ITIN, and they have been always told that there will be confidentiality around that, and it's in everyone's interest, among other things, because they are paying taxes. And right now, the IRS apparently has said to Homeland Security that they're going to start sharing that confidential information. So the extent of, I was thinking about this when I was listening to Peter's presentation, which also struck me as an area in which we are seeing devastating changes, potential changes in real time, and I'm just out of words, right? So we are trying to build this idea of a research to action hub and children in immigrant families, thinking that we can, with the advocates and community-based organizations and other researchers, start promoting these policies. And what we are saying is that the direction in which we are going is exactly the opposite. Mm-hmm. Mm-hmm. So it's not like before, like inaction, it's just completely the opposite direction. It just, I'm out of words, literally.
Yeah. Thank you. I see one hand over there. Oh, yes, okay. So I'm gonna actually get one more burning question. Do you have any question in this room? Oh, okay.
Thank you. Thank you so much for the presentations. They were very interesting. And so my question is for Dr. Ha. So I was wondering, for childcare subsidies, are there any impacts beyond the parent and child generations? So for example, for grandchildren, and how feasible would it be to study, like, for example, more than 2 generations at once? And what might be the impacts of this research?
So childcare subsidies, it's so there's a different eligibility. So if you're low income and then you have young children, you can receive childcare subsidies. And then also there's other children who are involved with child welfare system or other children in adverse environment. They can get childcare subsidies as well. But also there's informal care that the Massachusetts doesn't have a lot of cases where informal care, people who use informal care receive childcare subsidies, but I know that they are trying to expand that. But other states, there's a substantial number of people who receive subsidies uses informal care. So informal care is the care from grandparents or families or friends. So, I mean, it's always data issues, right? So if we can kind of have longitudinal data, just to follow up how they kind of utilize subsidies and how that impact, it would be great. But I don't know, there's not a lot of research actually they're looking at that, you know, what's the impact for more than 2 generations. But, you know, I mean, so there's a kind of significant amount of research that try to look at family, friends, and neighborhood care, and then how that impact kids' development, and then also parents' employment outcomes. So it's not just about grandparents, but also kind of family, friends, or neighbor cares. So there's that segment of research that looked at impact.
Right. So I would like to thank you to our wonderful colleagues. That was fantastic. Thank you so much. So as we wrap up tonight's discussion, I want to take a moment to reflect on what we have discussed tonight. We have learned how important it is for all of us to understand the impact of poverty and economic insecurities across the lifespan for our research to be actionable. These are not just abstract policy questions. They reflect real disparities, real struggles, and real opportunities for change. But the conversation doesn't end here. My hope is that we continue these dialogues beyond this room through research, advocacy, and policy work, so that we come up with better solutions for the economic security for all of us. So now I invite our Dean Barbara Jones back to the podium.
I think you can see why I am so proud to be dean at BUSSW, because I have such incredible faculty, and I'm really inspired by each of you. I learned so much. These are the days that you just say, okay, we have to keep doing this work, and we have to keep, as you say, find the funding for the action. So I just want to thank you for all the work that you do, for what you've taught me, and for keeping it actionable. I think you will all agree that now more than ever it is so critical that we support and fund and get out our social work research. So let's clap for them one more time, because I'm so proud. Really brilliant. And thank you very much, Professor Hahm, for organizing this wonderful day. So thank you. Before we close for tonight, I'd like to take a moment to thank our Markham team, our marketing and communications team. For their leadership and organizing. I'd also like to thank our staff who are running around and being our spokespeople, so thank you for that. Our fantastic team from Let's, and our photographer, Dave Green. So thank you all very much. And thank all of you for joining us tonight. It really, I know it is a cold night, but I think we have learned a lot, and so worth it to be in company with all of you. We hope the information will help illuminate the challenges we have today, and reinforce your commitment to continue the fight and how important this research is. So thank you very much for your support. I'll say goodnight to our Zoom colleagues, and ask our in-person crowd to please stay and join us for a reception and dialogue with our colleagues a bit more. So thank you all very much.